Hello, everyone, and welcome to Amy Laird and Donna Bailey's case study and presentation on exploring dimensions of the disability ability continuum. As we address the case study, our objective is to provide education and resources to help us all effectively serve this population in our social work practices. Over 55 million Americans have disabilities. That's about 19% of our population. And the Americans with Disabilities Act of 1990 is key legislation around disabilities that we'll be referencing throughout the presentation. This is the federal civil rights law that prohibits discrimination against people with disabilities. ADA defines disability as a person who has a physical or mental impairment that substantially limits one or more major life activities. And major life activities are a comprehensive list, including items you would expect, like walking, seeing, hearing, and also some that might not immediately come to mind, like mental processes such as thinking, concentrating, or the operation of major bodily functions, such as functions of the immune system. You can see ADA defines 4 categories of disabilities: physical, emotional, mental, and intellectual. We've included examples for each one of those categories, including ADHD, which is the focus of our case study. And that's why we included that last statistic, that 11% of children age 4 to 17 are diagnosed with ADHD. That directly relates to our case study.
Here we're going to go over a brief summary of our case. Joshua is a social worker at a private agency that serves severely emotionally disturbed children. The agency receives funding from the county mental health agency. Joshua started working with Matt, a 12-year-old boy diagnosed with attention deficit hyperactivity disorder and oppositional defiant disorder. Matt lives with his mother and brother. There was reported history of narcotic use, spousal abuse, and child abuse by the father. Joshua chose to spend much time with Matt to meet his quota of direct client time for billing. Over a 2-month period, Joshua spent his time between individual therapy, social skills sessions, and family therapy. Matt made progress in the 2-month period and thought of Joshua as his best friend. Joshua decided he needed to spend more time with another family after reviewing his workload and reduced his time with Matt. Matt expressed to Joshua that he didn't feel the same about him and questioned whether or not Joshua liked him. Matt's mother is also very upset because the boy's behavior is now worse than it was before Joshua started. She also stated that social services makes things worse and she does not want Joshua ever coming back to the house. Joshua discusses the situation with the supervisor and decide that a new social worker would be the best option for his family. We realized the case study did not specify Matt or Josh's race or ethnicity, and we decided to assign Matt African American for the purposes of demonstrating intersectionality with people with disabilities. So where does Matt fit in the disability population? Matt has been diagnosed with ADHD and ODD. ADHD is classified as a neurodevelopmental and/or mental health condition. There are 3 subgroups of ADHD, and they are combined presentation, which means that a person could exhibit hyperactivity, impulsive, and inattentive behaviors. The other 2 subgroups are predominantly inattentive presentation and predominantly hyperactive and/or impulsive. Oppositional defiant disorder is a pattern of argumentative, defiant behavior with common comorbidity with ADHD, and this puts a child at risk for poor outcomes, including development of substance use disorders. As we know, intersectionality is overlapping in interdependent systems of discrimination, and there's plenty of it in this disability ability spectrum. Here are some examples related to the disability ability spectrum. Women with disabilities living in areas with fewer resources available may experience violence, including caretaker abuse, sexual violence, and forced sterilization. Another example would be worker with disabilities who also experience racial discrimination. How does intersectionality present in this case? Matt has been diagnosed with ADHD and ODD and experienced physical, emotional abuse by his father. Children with ADHD are more susceptible to child abuse. It can be neglect, emotional abuse, and/or physical abuse. This can happen as a result of lack of knowledge about interventions for ADHD and/or genetic components that the parents have.
Nature and environment both affect disabilities, and the ecological systems perspective provides the basis for social workers to both increase the fit between human need and environments and influence the environment through organizational programs and policies and legislation. These items listed are the key components of Matt's environment that we've identified in the case study and that we'll be examining in detail as we go through the presentation. When we look at the broader disability ability spectrum as it relates to the ecological systems perspective, a key item is what we mentioned earlier, the Americans with Disability Act of 1990. Under this law, people with disabilities are entitled to all the rights, privileges, advantages, and opportunities that others have when they participate in civic activities. The EEOC is the federal agency that's responsible for enforcing the ADA, and then state and local agencies implement the policies of ADA. There's another key piece of legislation, the Individuals with Disabilities Education Act of 1975, and that ensures that students with disabilities are provided education tailored to their individual needs. And you may have come across individualized education plans. That is a result of that specific act. We know there are a lot of support mechanisms in the ecosystem for those with disabilities, but there are also huge challenges. The family caregiver issues, it's very important that there are caregivers and that they have resources, including respite care. And then there's still a huge stigma associated with disabilities, which can certainly lead to discrimination, prejudice, and stereotyping of the disabled. Disability is a broad category with many complexities and interdependencies, so it's important for us to remember that one size does not fit all. For example, research has shown these three specific variables specific to ADHD that can and should impact diagnosis and intervention, and that's just one example of ADHD. So the key for practitioners is that we must leverage research and pursue evidence-based interventions that are specific to our client populations and subpopulations.
Here are some cultural strengths, resources, and natural support systems for Matt. Matt attends a school for emotionally and disturbed children. This school provides a safe and appropriate learning environment for him. These schools are often used after less restrictive alternatives have been exhausted. Students attend the school with the goal to be mainstreamed back to their general education school. Matt also has the support of the school psychologist. He receives home-based counseling services from a private agency that include individual sessions, social skills intervention with his brother, and family sessions with his mom and brother. Matt receives natural support from his mother and brother. This next slide includes some additional resources for this population, and they are parenting networks for support and education, which can be face-to-face or through online support groups, and it's a way for the parents to speak to other parents about similar issues or help a parent out that maybe have experienced something that another parent has experienced. Community support groups by specific disability. Telehealth for communicating effectively to inform and support. And the telehealth has increased in the last couple of years, and it's a great way for parents to communicate with other parents and also for parents to communicate with their medical field. There's opportunities for transitioning and post-secondary educational options. And here are some keys to resiliency: strong social support networks, school, peer groups and community activities, church. African American students develop resiliency when exposed to positive ethnic images and messages in their academic environment. Virtues, solidarity, family traditions, and spiritual values passed from generation to generation in African American and other ethnic communities can be a huge source of resiliency.
There are certainly a lot of strengths to be found in the evolution of the perception of and response to disability. Some of these are listed here. For example, the traditional physical only definition has been expanded, as we saw on the first slide, to be the physical, mental, emotional, and intellectual categories. There's also been a shift from the category of either you are or are not in the disability category. It's now more defined as a spectrum of the disability ability spectrum. And that's really creating an evolving definition of what it means to be disabled. There's also a shift from the pure medical model to an understanding that social factors are also very key. And you can see also there's key legislation that has been a real advantage for those with disabilities, both from the United States standpoint with the ADA, and then from the international perspective with the United Nations standard rules. A key to remember as far as access to resources is that resources vary greatly based on the diagnosis. And a diagnosis does not necessarily mean you have a disability and qualify for resources. So, for example, a child may be diagnosed with ADHD, but not qualify for benefits like SSI and or an individualized education plan. We see there are a lot of resources here, like from a physical, for those with physical disabilities, there's just great technology out there. There's software to read documents for the blind. There's voice-controlled cursors, bionic limbs. There are also increased opportunities for services for emotional, mental, and intellectual disabilities. The resources are there. Access is, for some categories, more structured and more easily obtained than others. For example, veterans, children, and families, the access and the structure available for resources for those with disabilities is known to be strong, whereas other populations have more access challenges, and you can see the list there: homeless, incarcerated, immigrants. So immigrants, for example, they may have access to resources, but they may not even be aware that those resources are available to them. So those are some of the access issues that we deal with. Also deal with who's eligible for benefits and what's covered, whether it's through private insurance or public policy. So the key for us as practitioners is we need to have knowledge of the policies and laws and the resources and how to connect clients to those resources.
When it comes to the ethical issues in Matt's case, it is not best practice to develop care plans with patients based on billing processes. Joshua, the social worker initially assigned to Matt's case, blurred those boundaries between the worker and the client. Matt relied too heavily on the contact and the support of Joshua. When Joshua's client load increased, Joshua decided to reduce his time with Matt. Matt had not been prepared for this. Matt and his mother were left feeling unimportant and abandoned. Matt's case should not have been approached with a one-size-fits-all. Joshua should have approached Matt's case with a strength-based strategy that outlined a plan for progress. That brings us to the NASW Code of Ethics. Social workers rely on the NASW Code of Ethics to guide decisions and practice. In Matt's case, all of the core values, service, social justice, dignity and worth of the individual, importance and centrality of human relationships, integrity, and competence were all violated. The following ethical responsibilities to clients, profession, and society were compromised. 1.01, commitment to clients. 1.02, self-determination. 1.04, competence. 1.07, termination of services. 5.01, integrity of the profession. And 6.04, social and political action. The NASW has a specialty practice area focused on children, adolescents, and young adults, including physical and emotional disabilities.
When we look at ethical issues across the broader disability ability spectrum, of course, stigma is what that we discussed earlier, is a factor related to all disabilities. Additionally, there's potential discrimination against subcategories. For example, should ADHD be treated as any less of a disability than blindness? There's potential discrimination based on factors like that. There's also potential abuse of legitimate diagnosis and resources. And again, we as practitioners need to be aware of that. For example, there is a longitudinal study that was conducted in the US. You can see the details there, but the whole crux of the issue is it a disability or is it maturity? And this was related to ADHD. So it was the conclusion was that the youngest in the classroom, the very youngest in the classroom, had a much higher probability of being diagnosed with ADHD. And the question is that a disability issue or is it a maturity issue? And that's just something we need to be aware of as practitioners. Additionally, the potential abuse of benefits. I think we all know the story about the emotional support peacock in the airport. So we just need to be aware that there's potential abuse of legitimate diagnosis and resources.
Here are some skills that are crucial to effectively work with people with disabilities. Following demands of the client task, maximizing the resources and supports in client's environment, utilizing the empowerment practice strategies, strength-based and person and environment interventions, motivational interviewing to encourage self-determination and self-advocacy through empathy and reflective listening, family-centered care and interprofessional teaming, normalizing, reframing, and using person-first language to ensure that strength-based strategies are implemented. Social workers should always put the person before the disability. For example, you would say a person with disabilities and not disabled person, or a child with autism versus autistic child. Social workers should always focus on clients as individuals first and foremost.
How do we best pursue social and economic justice for Matt and the broader disability community? We need to continually focus on addressing oppression at the individual, cultural, and institutional levels. So for example, you see the third bullet point there. There are some examples of the individual level, but the third bullet point, for students like Matt with IEPs, short-term suspensions and other warning signs should trigger a review of the IEP. To determine if there's a problem with the instruction or other underlying problems that schools can't remedy through exclusionary discipline. Now, from a cultural standpoint, we see we need to focus on continuing to remove the stigma associated with disabilities. And at the institutional level, you can see these stats on students, including that top line there. Students with disabilities represent 12% of the overall student population, yet they make up 25% of all students involved in school-related arrests, 58% of all students placed in seclusion, and 75% of all students physically restrained at school. You can see it's even more drastic for African American students. And this oppression that we're talking about leads to social and economic discrimination, disenfranchisement, and exclusion. Examples again here, and let's focus on those last two. Youth, since the case study is around youth. Youth with disabilities only graduate high school at a rate of 61%, compared to 81% for people without disabilities. And youth with disabilities who do not complete high school education are far more likely to interact with the criminal justice system than those who complete their degrees. So it's like a domino effect. We can get involved through with policies, laws, and opportunities for action through advocacy. And this is an example that relates directly to the case study and the last two bullet points with those sobering statistics on students with disabilities. So the School to Prison Pipeline, STPP, refers to policies and practices that are pushing children out of classrooms and into the juvenile and criminal justice systems. This provides our motivation to get educated and advocate to help students out of this, and it's a very large issue with minority students. So it really requires an intersectional approach to disability, to addressing disability and racial discrimination. And this is where we can get involved. We can get we need to stay educated and get involved to advance human and civil rights for the disabled community. So here are three great organizations to get us all started. And there are lots more out there, but just 3 to get going here. The first one is Accessibility News Information, News International. And this is, it just provides international news. It's an international news site for the disability community. Contains information on all kinds of topics, including the late-breaking news on the ADA Education and Reform Act that was just passed in the U.S. House of Representatives. That requires businesses to, instead of proactively having to comply with ADA, it places the burden on the individual who's denied access. So it's a big potential change, and this is a source of information for us to stay current on what's going on with news related to those with disabilities. The next 2 sites are specific organizations that advocate for the rights of those with disabilities. So they're just great ways for us to get involved and connect with those for to advocate for this population.
Here are some other key organizations and events where we as social work students and practitioners can get involved to advocate for people with disabilities. There's VOR, which is advocating for individuals with intellectual and developmental disorders, American Association on Intellectual and Developmental Disabilities, American Association of People with Disabilities, Disability Rights Advocates, Disability Day on the Hill, which is a great opportunity to go to your representatives and speak to them about people with disabilities. It provides an opportunity for social workers to advocate to legislators about key policies and issues that impact people with disabilities. There's also supported decision-making, which is important for those people with disabilities that might need some support in making decisions, but don't need to sign away their entire rights to someone else. So that's a big one that's going on right now, and working towards giving people with disabilities more rights and what they're going to do with their life. There's Disability Rights Education and Defense Fund, Mental Health America, National Center for Learning Disabilities, National Organization on Disability, and then focused organizations such as Autism Speaks. In our conclusion, we would just like to say this population is diverse in nature. People with disabilities desire equality in their lives and the same opportunities as people without disabilities. They want to be known for their strengths and abilities and what they have to offer society. We as social workers have a responsibility to advocate and empower people with disabilities. Too often, people with disabilities are overlooked and seen for what they cannot do. When working with this population, social workers need to practice empathy and maintain a non-biased outlook. Advocate for people with disabilities as they deserve equal opportunities to contribute to society and live an enjoyable life. For the participation activity, we would like for you to watch the first 11 minutes of TED Talk with Amy Mullins, entitled The Opportunity of Adversity. For the first part of the discussion board, compare a 2009 definition of disability with the current definition. For the second part of the discussion board, reflect on Amy's view of adversity and how we can all approach our challenges. State whether you agree with her philosophy and why or why not.
We hope today's session provided information to help you understand the strengths of those with disabilities and to serve your clients in the disability ability spectrum. And we look forward to learning from the other teams this semester.